at how you determine blood type. Serum that has the anti-A or anti-B serum. So if we take a drop of blood and if we expose it to type A and type B, okay, this right here, blood kept its shape, didn't clump up or anything. Over here, it did, okay? So therefore, in the blood that was given, we're going to see that this blood had that particular antigen for that serum. And we used to do this in lab. So we got type A, type B, both of them clumps, so the person's AB. Down here, neither one of them clumps, so they're O, okay? And that's how I can remember doing my blood type, but I just don't remember what I did with it. It'd be kind of cool if we had that. Even though we're not supposed to do like real blood in lab, that'd still be cool. I'll have to check and see if we got some and test it and see if it works. So these groups that we get, A, B, and O. Usually your blood type is going to show up about 2 to 8 months after birth. Those antibodies, anti-A, anti-B, okay, usually you're at a maximum concentration around the age of 10. Now, hopefully the goal, don't form antibodies against your antigen. So if you're A, don't form A antibodies. All right? Now, if that happens, if the formation ends up and we have some antibodies, or maybe we get exposed to some antibodies, that's not good. Because what will happen is the antibodies and the antigen will form together. They'll begin to clump the red blood cells together. This will then begin to clog up, clump up in the vessels, and especially in smaller vessels, to the point that your basically organs are going to shut down.
So, if you're A, you don't want to make A.
And you don't want to
B.
get like B blood, because B is going to have the A antibodies.
So this only happens when there's like a mix-up of blood?
Yes. Yeah.
Can this happen when you're pregnant? Because I know there's...
Yes, we're going to talk about that.
Okay.
Because even though we're looking at it now of just saying A, B, and O, we have to deal with A negative, A positive. We have to deal B negative, B positive. All right, so we're going to look at that. So if we get the agglutination, okay, usually due to a mismatch, all right, we can see them attached to the red blood cells. Red blood cells clump together. They can block small blood vessels. They can hemolyze, burst apart the red blood cells. They can release this. It can happen over hours to days. Usually if a mismatch in a blood transfusion has taken place, they know within a couple of hours. The quicker they catch it, I think that they can do stuff now about it, okay? But the longer it takes to identify it, the greater the chances that the person's going to die from the mismatch that takes place. So usually what happens is organs in the body begin to shut down. This is sort of what happens when we get that transfusion. Usually, under normal conditions, in our bodies, we don't develop anything that's going to be the antibody and the antigen that are going to react together. Okay, that's usually not going to happen. Now, in certain cases, okay, because they're trying to show you that we've got the type A donor, but the person is type B. Therefore, it caused the reaction. Now, it used to be that O could be given to AB, or O. That is still the case, okay? Type O is the most common blood type, and you do hear it called the universal donor. The universal recipient could be A or B. If you have AB. If you have A or B, there tends to be a little more of a problem, okay? Now, the reason that type O was such a good donor, it doesn't have any antigens on it. Make sure everybody's Everybody's in there. Don't ask me, I don't know. So it used to be that with O, okay, because that could be the universal donor, but there's some other things that happen. This is where we come along to, now we have to realize, are they O negative or O positive? Okay, so with type O, for the most part, now that we have been able to separate the blood into these three factions, okay, now when you're given blood, like if there's a loss of blood, you're getting mostly just the packed red blood cells, okay? So a person with the type O blood who's gone and given blood, usually those packed red blood cells from the O, they're not going to really cause a problem, okay? Because you're not getting anything else. Where does the problem come from with stuff clumping up? Does it come from the red blood cell itself? Where does it come from, Meg?
Antigen?
From the plasma portion. So they have now taken blood and they can break it into its plasma portion, the red blood cell portion, and something with interferons, immunoglobulins. So they have these three factions that they can break it into. So you're not getting that plasma portion. So you're not getting the portion that would create an issue. So the hope is that by using just those packed red blood cells, type O is good to go. Okay? That you can give that to the person of A, B, or O. AB, they can get it from A, they can get it from B, or they can get it from O, or somebody else who's AB. Does that make sense? Because they've already got A, so if they get it from A, they're good. They've got B, so if they get it from B, they're good. O shouldn't have anything, so they should be able to get the O blood. And if somebody else is AB, then that's fine, because they've already got that. So normally known as the donor and the recipient for being the universal. But see, here's where it gets a little more tricky. The RH group. Are we going to be negative or are we going to be positive for the RH? These were discovered in the rhesus monkey, therefore given it the RH factor. It is extremely reactive in the blood. Now,
I have a different slide.
which
Oh,
one?
wait, no, wait. I missed it, sorry. I turned too soon.
Okay, so RH, this rhesus factor, very reactive. A patient is going to be considered positive if they have the antigen that's present. The frequencies vary. Some ethnic groups have more, some have less. But what exactly are we looking at with the positive and the negative? We're going to talk about it in relationship to what is probably the most common. What we might see in a female being pregnant. The first pregnancy for a woman is fine. Doesn't matter if mom's negative, positive, it doesn't matter, okay? They usually identify the problem, and after the first baby is born, mom will be given the RhoGAM shot. And then, hopefully, any succeeding pregnancies will go to term and mom and baby will both be fine, okay? This RH that we're dealing with, in an RH negative individual, okay, if they get exposed, okay, they can now have problems with that positive negative in their blood. So for example, a negative woman with a positive fetus or the transfusion of the positive, in the very first pregnancy, no problems get created. However, in succeeding pregnancies, there can be a problem because RH positive once again, we're looking at that red blood cell. All right? Now, at this point, if they are positive, if they have the RH that's positive, what you're going to see is that they're going to have that antigen on the red blood cell surface. If they are negative, they don't. Now, that tells us that if this person is type A, and if they have, do y'all remember how, let's see, it was like the little 3 sugars, and then the swinging down sugar, okay, for A, just the colors were different. So, if they were A positive, this means that they would also have on their surface the RH positive, the antigen for RH positive. And that would tell me that this person is A positive. If they had the red blood cell with the type A, but there were no other antigens on their surface, that tells me they're A negative. They don't have that RH antigen on their surface.
Can you repeat that last part? So the A, so on the A negative, there's not on the surface, right?
Right. In other words, for the positive, on the positive for RH, let me draw it in RHs, okay? They would have the little RHs on their surface, okay? If they don't have those RHs on their surface, they're A negative. So the same thing would be the case if they were B, if they had the little RHs on the surface, they're B positive. If they don't have them, they're B negative. Does that make sense? So if they have the little RHs on their surface, they now have the positive attached to their letter. So now